All right. Welcome again to the first episode of Not Your Average BrOT podcast. I'm your host with the most, BrOT Cole. I am a Johnson & Wales Occupational Therapy doctorate student. Today I'll be talking to you guys about what a BrOT is and what we can do for BrOTs in the future through like a podcast format. And I have a special guest with me. If you'd like to introduce yourself.
Hello, everybody. My name is Ruben Blanco. I am a fellow BrOT at the University of Johnson & Wales in the same program Cole's at. So, yeah, it's an honor to be here, Cole.
Oh, thank you. No, thank you, man. I really appreciate this. All right. I guess to start off with the podcast, what is a BrOT? Well, a BrOT is a male occupational therapy practitioner. And in most cases, we use BrOTs as like a camaraderie statement. Would you agree with that, Ruben?
Yeah, absolutely.
All right. Well, some little history about the term BrOT. From what I found, it can be credited to two male OT students back in 2011 in Philadelphia. They have now currently started their own little BrOT movement called BrOT Movement Incorporated back in 2016. So now I guess the BrOT term has become more of an initiative for diversity and inclusion for occupational therapy practice. Um, yeah. So what are your thoughts, Ruben, about what I just told to you about BrOTs?
Yeah, I think it's cool. I think the term BrOT is definitely more of a camaraderie. It reminds me that I have other people to, I don't know, like have a group of like-minded individuals with me. I really like the term camaraderie. I just feel like it's like a brotherhood. We're part of our own little secret club. Grad school is already hard enough, so having someone like you to rely on to bounce ideas off of is great. And I think having other BrOTs to diversify our profession is amazing.
Awesome. Thank you. I'm glad that we get a chance to do something like this. I know we've been talking about it for a while, you know?
Yeah, man, it's only gonna grow from here. We had our hiccups along the way, but we're getting there.
All right, yeah. So before I really wanted to do this episode of the podcast, I looked up some research and stuff if there were any like research for perceptions of male OTs or maybe like just studies for with male occupational therapists in general. And some of the literature goes way back till 1995. The most current research that I saw was in 2018. So there are still some like big deficits around this topic, I guess.
Yeah, for sure.
The 1995 research study looked at the satisfaction of male OTs and the outcomes of it, or the results, were that male OTs were a little dissatisfied for like some role ambiguity, not really knowing what they should do, what's appropriate, or stuff like that. This is also from some of the recent research too in 2018, which talked about or had themes of masculinity, stigma, and also satisfaction as well. Do you have any thoughts about this, Ruben?
Yeah, I mean, I think, yeah, I for sure we're gonna face things like that. Being males in the OT profession, it's so there's not many of us, as you can tell in our program. There's only you and I, and that's just about it. I remember talking about in our foundations course, what are some things that we could do to diversify our profession, and a lot of individuals in our profession are white females. And then we just talked about how you and I are the only ones representing males in our program, and I don't know. We just have such a small population of OTs. But yeah,
No, I like that you brought up white females and just white occupational therapists in general, there's a large percentage of occupational therapy practitioners who are white and not, you know, and that makes non-white BrOT population even smaller, you know.
Yeah, which is crazy because you and I both fit the bill for that as well.
Yeah. Also interesting from the research was the topic I mentioned about stigma and how some healthcare disciplines might be viewed as a more feminine practice than opposed to other healthcare disciplines, such as like nursing. I feel like
Yeah,
that might be more recognized as a quote unquote feminine career. Have you
yeah,
ever felt
absolutely.
like in the world of that?
Yeah, for sure. I mean, yeah, I feel like almost every healthcare profession is more female dominated. It doesn't make me, it might make me a little bit uncomfortable just because there's not many males out there to relate to me. But it's not something that would deter me or anything like that from a profession like this, just because I think males belong in healthcare. I think we bring cool perspectives, different perspectives towards that. And yeah,
All right, yeah. I mean, the research also mentioned like strengths of what male OTs perceive that they have. Some of these strengths are actual physical strength. In some situations and sites, males might be more apt to get like clients who require like heavier transfers, stuff like that. Other situations, male OT might get a more either aggressive client or a client that's might become more like harder to deal with maybe in some circumstances. Would you think that's common or
um, I feel like now that you've talked about that research, I think that makes sense. I feel like we could be a little bit more well equipped to handle situations like that. I think as long as the patient is safe in the end, doesn't really matter who's treating them. But yeah, I do think that that definitely makes sense, especially with transfers that might be a little bit heavier. I guess it would make sense to have a male or somebody who, or an individual who just works out a little bit more than your average person. But yeah.
yeah, for sure. What are your thoughts about like being refused by a female client who you go into doing a ADL activity or you had planned to?
Yeah. Definitely some thought that or something that I've thought about for sure, especially going into our profession, because we are going to be doing things like you said, ADLs that are usually a little bit more private, like going to the bathroom or bathing and things like that. I think it's just important to recognize that we're there to help our clients at the end of the day. Um, and just tell them exactly what's going on, what are the steps to this. Also being transparent with the client, asking them what they feel comfortable with doing, and if they do end up refusing us, also validating those feelings. I think it's important to let them know that it is okay to feel uncomfortable with a male or anybody like that. Um, and just being super open minded about it and not being too hurt because it's not it's something that we can't control. um, so not being too hurt about it. Again, validating those feelings and just letting them know that it's completely okay. And yeah,
Awesome, awesome. I think that's a great answer. I mean, I think male OTs might experience some fear or maybe anxiety going to some of those situations too. Like maybe we might feel a little unprepared. Maybe. Would you agree with that or no?
um, yeah, I feel like I could agree with that. And we have we have our lab tech who's a male COTA, and we can absolutely have those conversations with him. But like you and I, or like you had said earlier in the podcast, there's not many BrOTs, so we don't have the opportunity to ask those hard questions to other BrOTs and how they handle that situation. So that level of unpreparedness definitely come into play. Um, so yeah, I think a lot of it is going to be like social media outreach to figure out how other BrOTs navigated situations like that and how they handle those conversations. Um, but yeah,
Awesome. I guess that's another reason why I wanted to start this podcast, just to talk to other BrOTs out in the world, educate one another, support one another.
yeah, it's an if there's not one thing that you and I take away from our program, it's to advocate for our profession and ourselves. I think this podcast is a great place for advocation advocating for other BrOTs out there, other males who are interested in the profession. So yeah, I definitely think that this podcast is a great thing for that.
All right. Yeah. Yeah. I'm really looking forward to continuing this. Like, there's so many other avenues we can continue to make with this, I guess, possible YouTube channel or even just a podcast in general. I think it would be pretty
Yeah,
cool to explore our opportunities.
it's kind of unlimited, kind of just like the world of OT. There's so many different things that we can do with this podcast, and in the realm of OT, it'll be interesting to see where everybody else's perspectives lie and things like that.
Yeah, for sure. What are some things do you think that male OTs bring to practices?
Yeah, I feel like males bring a more direct approach to like intervention planning and things like that. I think, yeah, like partly that, but also having a male OT be like funny, comfortable, goofy, kind of like how you and I are during labs and things like that, open minded, also brings like another level of comfort to the clinics or whatever setting that we're going to be in, like school systems, because they're like, oh, a male who's supposed to be perceived as like super strong, super like, I don't know, boring or like manly. It can like come down and be goofy or having a lot of fun, smiling, being vulnerable and things like that. I think we can just bring a lot of like comfort to an environment, an OT environment like that.
Yeah, I mean, I always hear that, like, in public schools, like, they love to hire male teachers? Like, I feel like there's an interesting reaction or, like, interactions, like, that are a little different than, um, like, a female teacher or even, like, a healthcare provider might have with their client, where our interactions could be similar, but still a little different, like, in the minor things.
Yeah, absolutely. I think, yeah, I think that we also like going back to your stigma question and things like that. A lot of people don't really see males as being in the healthcare profession because they don't think that we care as much because they're supposed to be manly men. But I think just like what you said about teachers being or male teachers being hired in the schools, I think they understand that males can be just as caring as females. Um, and at the end of the day, we're all just humans. So we have an understanding of care and love and things like that. But yeah,
Yeah. It'll be interesting to see other BrOT thoughts too in the future.
yeah, other BrOT thoughts and in different settings as well. I think it will be extremely interesting because in different settings, you're going to have different approaches, especially at like a skilled nursing facility versus a pediatric facility. Those are definitely going to be two differing sites. So yeah,
Right,
I
and
think it'll
that
be
could give
interesting.
insight to like how situations with like ADL interventions with female clients might come up too.
Yeah, absolutely. Absolutely.
Yeah. Well, I guess it's come to a wrap for now. How do you think this podcast went for you?
I think it went well. It's really interesting to see the research that's out there. Obviously, there's some gaps in the research. 1995 to I think you said 2016 is,
Yeah,
or is it
2018,
2016?
man.
2018 is a very large gap in literature, and I'm looking forward to future podcasts, man. I think this is amazing. I think it'll be create great opportunity for the world of BrOT or OT in general. And yeah.
Yeah, I'd say so, man. I'm looking forward to doing this more in the future, especially after when we get by our studies, you know. So
Yeah, getting by fieldwork and capstone, I feel like as we go through that, we're gonna have so much more knowledge. Um, that'll be very valuable to other BrOTs or OTs in general.
well, man, I can't wait to do another podcast with you. Um, and as we say goodbye, just want to say to like and subscribe, guys, please. And always
Yeah,
look
like
out
and
for one another,
subscribe.
man. And remember,
Absolutely.
BrOTs are the minority of the sorority.
Great.
All right, thanks, Ruben.
Thanks to you, Cole. This has been fun.